Well, welcome to this Wednesday Ask an Integrative Doctor from Tustin Longevity Center. We do these every week at 9:45 in the morning. And our goal here is to try and help our patients with additional information on integrative, natural, complementary, holistic care approaches to our healthcare today, and an emphasis on preventative issues. We're trying to keep people well and prevent the disease. We're a group of 5 doctors, and we are enjoying an extraordinary amount of preserved health here. We don't really have the incidence of the prevalence of heart attacks or blood clots or new cancers or diabetes onsets. In fact, we see the reverse. And through these preventative measures that we are trying to help reinforce with our patient education, we've designed these videos. Today's topic is going to be on iodine and thyroid health, but it's much more than that. We are all trying to, as I do this little primer on it, remember you can put your little questions in the chat box there. So I'll try and answer any question you have, but we're going to prime the pump today with iodine. So iodine and thyroid disorders are something that we look at also in our holistic preventative approach. If we go back in history a little bit and we look at back to the 1920s, 30s, we started seeing a lot of uptick, prevalence, emergence of goiter. And the goiter then was associated with iodine deficiency. And maybe one of the best United States health initiatives to date really was when they had iodinated salts sold, and then we saw the incidence of goiterogenic goiters of the thyroid greatly reduced. And so iodinated salt had been around, but then around 1970s, 1980s, they started having radioactive iodine for many of the imaging studies, and a push went out from the powers that be saying, let's get iodine out of the food sources, because you had iodinated bread, iodinated cereals, iodinated wheat, grained products, all the baking goods. And that was because if you had enough iodine, and let's say you were going to do an IV dye with radioactive iodine, it would not work for you because all your receptors needing the iodine were already filled with healthy natural iodine. And so they took the iodine out, and we have seen for the last 40 years a deficiency in iodine in the United States. My personal experience over the past 20 or so years since I've been testing iodine levels is a little over 95% of all my patients are iodine deficient, and mostly a significant deficiency, not a mild deficiency. So then you have to ask the question, what did they replace the iodine and the baking and stuff with? They replaced it with bromelain. Bromelain is in the same halogen column of the elemental charts where iodine is, and fluoride. Now, you've all heard how water is fluoridated, dental care products. And on the aside, just to go down a rabbit hole, in Europe, they have largely eliminated all the iodinated, rather fluorinated water, because they found no benefit in preventing cavities. That's clearly established. You don't need fluorine for cavity reduction. So they fluorinated the water, which is in mass action, bumps off the iodine that you may have and bullies it out of its receptor site. They brominated the baking products and much of the food. Your canned goods that have water in them and canned products, they have the fluorinated water use as well. And if you drink sodas like Mountain Dew, that's full of bromelain. And all the people that I have tested for bromide excess have been the iodine deficient people. So usually if there's an iodine deficient, there's a bromelain excess. And if you recall, in the old psychiatric medicine, they used bromine and gave it to people to kind of dummy them down, calm them down, dope them down. So we also know that iodine is very important for IQ, intelligence, in general. The metabolic process of every cell of your body needs iodine, and if you're iodine deficient, you'll probably have some cognitive disorders, mental IQ diminishment as well. So given that backdrop, we also need to add in one more pillar of knowledge, and that is all your glands, your thyroid, your breasts, your ovaries, your uterus, your prostate glands, all the glandular tissues, your adrenals, all of them need iodine. And all glandular tissue architecturally is dependent on iodine for its efficient work. So people with fatigue, adrenal fatigue, people with polycystic ovarian syndrome, people with nodular thyroid, people with fibrocystic breasts, people with fibroid uterus, people with benign prostatic hypertrophy. These glandular tissues have all exploded in disease format in the last 40 years, correlating with the diminishment of iodine in our natural diet. So we would make the assumption that it isn't a lack of, mammograms and imaging testing and biopsies that we have that is not discovering the cause of these diseases. It's more likely the loss of iodine in our healthy prior lifestyles is associated with the expression of these diseases in all of our glands. So instead of worrying so much about getting a lot of imaging, biopsies, mammograms, and testing like that, I worry more about measuring your iodine levels. Now, in medical school, conventional medicine, allopathic medicine, this is not emphasized. The imaging, the biopsies, the mammograms, they're mentioned all the time. But it was conventionally taught that all you need to test is a thyroid-stimulating hormone for thyroid health. And we clearly understand that that's not sufficient today. In order to do a healthy thyroid assessment, you need a very good full panel. After all, it affects all the metabolism throughout your body. So we would get the TSH, but we'll also get your free T3, free T4. We will get your thyroid peroxidase antibodies. We'll get your thyroglobulin antibodies, and we'll do a reverse T3 very often. That would be our minimum approach to get a very good picture. And we'll look at your depression. Even depression with fatigue is so much associated with just going ahead to give you antidepressants. I think a good doctor would first look at all these healthier glandular hormonal issues before prescribing an antidepressant. So we would do this as our core approach. And what do I find? Again, over 95% of my patients that I have studied to date over the past roughly 20 years have a iodine deficiency. So I have patients coming in most often with fatigue, most often with depressed moods, even some anxiety is associated with this. My patients are having bowel constipation, dry skin. They're having both hair loss from hypothyroid and hair loss maybe from excess thyroid activity. We have the autoimmune thyroiditis, we have the Hashimoto's thyroiditis, we have the Graves' disease, we have thyroid cancers. 1 in 7 women have breast cancer now, the prevalence. 1 in 3 men have prostate cancer now. We have adrenal fatigue. We have all this polycystic ovarian, fibroid uterus, dysfunctional uterine bleeding, all these things. And I'm suggesting we need to begin with very safe, non-invasive studies to look at your iodine levels. So how do we approach this? Well, there used to be iodinated salts, iodized salts. And you can still get that at your store, but you really only absorb about 10% of iodinated salt, and that's white, and that means it was bleached. So you don't want the chlorine bleach, because chlorine, fluorine, bromine are all in the halogens on the elemental chart, and they bully over iodine. So you really don't want white looking salts. You would like the colored salts, Himalayan salts, sea salts, Celtic salts. These salts that look colored and dirty are because they're full of minerals. They have many, many minerals, and minerals give the color to the salt. And so in general, mineral replacement is very important along with iodine replacement. So what we do here is, and I'm going to show you, we have a item called iThyroid. iThyroid has per capsule 7.5 milligrams of potassium iodine, and then free iodine 5 milligrams. So roughly 12.5 milligrams per capsule of the iThyroid. Okay, so that's one of the items we use. The other item is put out by Dr. Bernstein, David Bernstein, and he's a family practice doctor in Michigan who has written several books on iodine and iodine replacement, and his experience is my experience as well. And his book is very good to read. I forget the title name of it, but David Bernstein, iodine, and you'll find that in the book area on your Google search. Iodoral is his product that he put out, and each tablet here has 12.5 milligrams of iodine in the same format, 7.5 as the potassium salt of iodine, and iodine 5 milligrams, total 12.5. Now, this is our iodine replacement protocol, and or items that we use, and we want for you to see a healthcare provider to assess your need for iodine, how much. I would say the men who have the least prostate cancer and breast cancer would be in Japan, and their natural iodine consumption from seaweed, things like this, is about 13 milligrams a day. And they have a national decrease in the prevalence of breast and prostate cancer. So that's why we came up with the 12.5 milligrams, because that's about the daily human average intake of a nation with a very low prevalence of the prostate and breast cancers. Now, if you already have problems, you might need 25 milligrams, 50 milligrams or so. So you need to see your healthcare provider who is informed on iodine supplementation and assessing that with a full panel. The other thing is, when you take iodine, iodine doesn't work alone in your body. And since it's involved in every cell metabolism of your whole body, that means there are other important nutrients that are helpful to get your iodine replacement or consumption better managed. And that is B vitamins, in particular vitamin B2 and B3. And vitamin B2 and B3, typically what we do is we don't give them in an isolated format. We give ours as a high quality methylated B complex that includes the B2, the B3, but all the other several B vitamins. So when I am giving iodine, I am always trying to make sure my patients are taking additional B vitamins, because you need that for the iodination and the absorption of iodine in the intracellular space. Selenium is very important to iodine healthy function. So we also have a selenium. But if my patients are taking a very good multivitamin mineral with the B vitamin, with the selenium that has the B2, the B3, then I'm not so worried about any isolated supplement of just selenium alone. So a very good, excellent multivitamin mineral would be our TLC Energy Core that includes the B2, the B3, the other B vitamins, the selenium, plus a very, very important item is magnesium. Magnesium is probably the #1 mineral deficiency in the United States, and so supplementation, of course, we have it in our multivitamin as well. Our magnesium content is, let me look at it here. Magnesium is 100 milligrams of the albion chelated amino acid chelates, which are better absorbed. The other way I give the magnesium, and this is very fine supplementally, is I mix it with water as a magnesium drink, and there is 200 milligrams in this drink. I mix it with vitamin C because antioxidants are important in your iodine metabolism. So I'll take a scoop of the magnesium with a scoop of the vitamin C. There's 4 grams of vitamin C per scoop, at least a half scoop. You need 1 or 2 grams of vitamin C to optimize your thyroid production, and a very good antioxidant. And I think last week I told you our favorite antioxidant spectrum is the whole food, fruits, vegetable, and berry blends of the Juice Plus series. So I put everyone on that. So magnesium, vitamin C, OptiMag Neuro, Vitality C, a scoop a day when you go to bed is a very nice way to allow your body to heal at night. A very good multivitamin mineral that has all those things in it. But as you get older, you need extra help. So I'm older and I need extra help, so I take it. And the other thing is we do have multi-mineral supplementation separate, where we do have the selenium and the magnesium in this with other very valuable minerals. The point also is you have to drink a lot of water. Water is always the foundation of any health nutritional advice system that we do. So what we have done is we check this. We'll be seeing iodine deficiencies. We'll give the minerals. We'll give the iodine. And then often we'll use natural whole glandular thyroid replacement for the body. I would say at least in 50% of my patients, I find some inadequacies from the chronic iodine deficiency. So I will be using that often. Many times when our patients might see another doctor, they'll see that their TSH is low because we are replacing them with thyroid glandular, and their conventional allopathic doctor will say the TSH is too low. So we've created a nice little letter that summarizes all of our philosophy on the guidance and the science references on thyroid stimulating hormone measurement in the lab as an indicator of thyroid function. And it clearly establishes is that's inadequate alone of itself. And just because thyroid is low does not correlate with too much thyroid replacement hormone at all. So we've put in all the references there. So if you come here as our patient, you might ask for one of these copies. Dr. Merrick, Janelle Merrick, is one of our medical doctors here. She put this together to assist with that. So we want to remind you that next Wednesday is Christmas, and the following Wednesday after that is New Year's Day. So we are going to be closed and not doing this process of the videos for our patient education on the next 2 Wednesdays. So it'll be next year in 2020 when I do see you again. I have great news also. We have heard you, we are listening to you, and we hear a lot of you would like us to be open on Saturdays. So starting in January, we will be open now all Saturdays, including the IV suite. So please tell your friends and your family, those who have trouble, if they work during the week and have trouble getting in, we will be here open on Saturdays, roughly between 9 a.m. and 2 p.m. And the IV suite will be open, and we'll be able to help you with your nutraceutical needs. The wellness store will be open. We also want to remind those of you who have some last minute little stocking stuffers to do that we have the gift certificate from Tustin Longevity. You can put a little cash and nominate someone for a gift here, and we will honor this. We also want to remind you a nice stuffing stock is the Doctor's Nutrition Bar, and the research that we put into developing this over the past 25 years on cell membrane repair. Remember, the injury to the cell membrane, which is 50% fat, phospholipids, and 50% protein, we have jam-packed this into this bar. Our research shows all the fatigue and the enhanced concentration, the appetite suppression, the enduring stamina that you get from this, as well as the fact that we did the study showing it doesn't spike your insulin. It does not spike your glucose like the other popular bars out there that we've tested it against. So this is a very smart, wise thing to have around so you don't eat something cheap and poor. And with that, I will ask if I've missed anything, Blake, or if there are any questions.
We don't have any questions. I think you covered everything.
I covered everything.
Yeah.
Okay, so I want to wish you all a very Merry Christmas and a Happy New Year. We won't be here next Wednesday, which is Christmas, and the following is New Year's Day. I'll see you the very first Wednesday starting in January. What date will that be? I think
probably like the 8th.
The 8th, something like that. Yeah, around the 6th or 7th or 8th is the next Wednesday that you'll be seeing me. I will be planning a seminar in January, and you can let me know what your preferences are. Type it in the chat what you would like me to talk about on our next seminar. Remember to enjoy wonderful treats on the Christmas Day and New Year's Day, but the other days, please start incorporating some fasting and drink plenty of water. All right, take care.